Good evening everyone. I am Dr. Souwndariya, consultant rheumatologist practicing in Chennai. This is a basic awareness program about rheumatological diseases, and I am going to divide my talk into two. One is for those who are new to rheumatology and another part is for those who are on treatment already for the rheumatic diseases. So first let me begin with for those who are new to the treatment in rheumatology. What is rheumatology? That you should first understand. Rheumatology, it is a division of science that deals with autoimmune diseases. You would have heard about the term autoimmune diseases. Let me explain what are they in simpler terms. The immune system is actually the police force of the body. It is meant for the protection. There are numerous microbes or microorganisms like bacteria, viruses. They are spread in the air around us, and it is the immune system that is giving the adequate protection for us for not contracting the infections easily. So what happens in autoimmune diseases? This immune system, instead of getting a central control, it acts on its own autonomously. So it acts in a bizarre way and it hurts our own body. So what are all the systems that are affected in autoimmune diseases? They are basically multi-system diseases, and the most common manifestation is the arthritis or arthralgia or the joint pain or the swelling, which commonly everyone affected by autoimmune diseases would encounter. Like how fever is a basic symptom seen in all wide range of infectious diseases, ranging from a viral fever or it may be an enteric fever or tuberculosis. Fever is a symptom. Fever by itself is not a diagnosis. Likewise, arthritis or joint pain or swelling is a symptom rather than a diagnosis by itself. There are numerous diseases that belong to the autoimmune spectrum. The most common being rheumatoid arthritis, which you would have heard. It is not only the rheumatoid arthritis, and there are numerous other arthritis, namely psoriatic arthritis, spondyloarthritis, the most commonly called as ankylosing spondylitis, which everyone would have known about it, which is affecting mainly the spine and the joints which are located in the midline of the body. Gout is caused by increased uric acid, and these are some varieties of arthritic diseases. And there are other connective tissue diseases like lupus. Lupus is commonly called as SLE or systemic lupus erythematosus, scleroderma, mixed connective tissue disease, myositis, vasculitis, and many are there. Even in these connective tissue diseases, we have joint pain as a symptom. So here comes the role for the rheumatologist. Because arthritis by itself is not a diagnosis, and hence the rheumatologist will evaluate a patient completely, assessing from the hair to the tip of the toe what are all the systems are involved, because these are all the multi-system diseases. It can manifest as hair loss, it can manifest as skin lesions, it can manifest as some inflammation in the lungs, it can be in your gastrointestinal tract or anywhere, or in your muscles. So the arthritis, along with its presenting symptoms in other parts of the body, will lead to a particular diagnosis. So the rheumatologists are the specialists dealing with these autoimmune diseases. So it is the duty of the primary care physicians whom you commonly approach, either a family physician or a physician nearby. They will refer to the specialist rheumatologist if they see the joint pain or any other thing which needs specialty care. The common notion is that joint pains are commonly seen by an orthopedician, but it is not so. An orthopedic surgeon is the one who is doing surgery for fractures or any other bone related problem. This is not a bone related problem. The problem which is occurring in the joint is an autoimmune. So something is there in the blood which is affecting various parts of the body. So joint is one among that, or joint is the most commonly affected organ. So when you should see a rheumatologist? If you have joint pains along with some stiffness in the joints, especially in the early morning hours once you wake up or out of your bed, if you feel some stiffness persisting in your joints for more than half an hour, or you feel some swelling or the joints getting in bigger in size, or you feel you are unable to work or you are unable to do your daily day-to-day activities, you can approach a rheumatologist if they are nearby, especially in an urban living, or if you are in a rural area or in any other periphery center, you can see your family physician. Never go to a medical shop and buy the over-the-counter medications and treat yourself, because it is not the pain that matters. The tolerability of the pain varies from individual to individual. As I said, I am again reiterating that the inflammation which is causing these symptoms are mixed up in your blood, and these conditions, they require special medications with monitoring of the side effects for you to get treated. With the treatment, I can assure that you people can live a normal daily life as like a person without this condition. That is the purpose of getting treatment from a rheumatologist. And the rheumatologist, on seeing the patient affected by these kind of conditions, will evaluate appropriately, and the initial set of investigations may contain specialized investigations like immunological tests, your CRP, C-reactive protein, ESR, erythrocyte sedimentation rate, rheumatoid factor, anti-CCP, ANA, anti-nuclear body. They will test all these in the initial part, and once the diagnosis is confirmed and once you are put on the drugs specifically meant for the treatment of the condition, you will be followed up thereafter for an adequate control of the underlying problem. The purpose of the treatment is living free of any deformities and as a normal life which everyone can lead. And my second part of the speech is for those who are on treatment for a rheumatic condition. So I am going to clear about the doubts which everyone in my clinic would ask about it. The initial time, the first visit, they come to meet me. Once I prescribe the drugs, they will be pain free within few days, and they will be able to notice the difference of them without the treatment and with the treatment, and they will be very happy about it. But this lasts only for 6 months. Once they achieve a desirable condition without any deformities, pain or swelling, the doubts there start. Whether this treatment should be lifelong, or these not devoid of any side effects. Why should I alone take this much of tablets? Why I alone get affected? Why I alone get affected when no one in my family has got affected? These are all the common doubts I have encountered. So I would like to clarify one by one. The treatment for any rheumatic condition or autoimmune disease is lifelong. You have to get the treatment. You have to understand the point. It is with the drugs that you are able to lead a normal life. If you are not on drugs, again the inflammation tends to rise and the disease activity will be upgoing. So you have to get control with the drugs. So do I get side effects with this? Will my kidneys be affected? Will my liver be affected? I wonder. When people, they are not afraid about the same condition when they get the medicines over the counter. Even when I buy medicines for myself in the medical shop, I can see people adjacent to me asking drugs for pain there, here, weakness. What do they give? We don't know. But we are not afraid about the liver affection or the kidney affection by those medicines. But once they come to the specialist, they have a lot of doubts prescribing these amount of drugs and the side effects they can encounter with these. I agree. No drug is devoid of side effects. Any drug will have its side effects of its own. But it is not that you will get the side effects always. It all depends upon the genetic susceptibility of the particular individual and the dose taken and with or without monitoring. In my practice, I have seen side effects are those for people who are not coming for regular monitoring or follow-up. It is why the rheumatologist always asks the people to come at least once in 3 months for monitoring. So they usually ask routine blood investigations for every visit. It is not that we are not going to achieve anything by doing phlebotomy for you once in every 3 months by asking you to come. It is for the prevention of the side effects. Every rheumatologist will ask for the blood test every time you go to his or her clinic. And it is not the pain tolerability. You can live with the pain. The tolerability level differs for each and every individual. But the thing is that you have to prevent the deformity formation. We are not treating only with the painkillers or any other drugs that just reduce the pain and swelling. The drugs are going somewhere in the body, acting, modifying the disease in the baseline so that you will not get the deformities in the future. And see, if the inflammation continues to persist, what happens? The disease which has manifested in the joints initially will involve other organ systems like lungs, eyes, heart in its sequence. So it is the inflammation that has to be prevented. And the next doubt, why did I get affected? Why did I alone when no one else in the family has this disease? It is some genetic change that has made you vulnerable to acquire this disease. This doesn't spread from person to person. It is by your own genetic susceptibility with some added environmental factors. We do not know which infection has triggered the formation of autoantibodies or the phenomenon of autoimmunity and your disease. The etiology or the cause of the disease is not known. And if anyone else in the family has this particular disease, it is not that the next generation will acquire. But definitely when compared to a person or a family who does not have this connective tissue disease, you will be having an increased risk for acquiring that. That is it. It is only the increased risk when compared to a person or a family which do not have this problem or the connective tissue disease or arthritis. So I wish to conclude that treatment is lifelong, but with proper monitoring you can live without side effects. And it is the past that people lived with deformities, but now there are a number of drugs that are available in the market which can abate the inflammation inside your body and subsequent deformity formation. And previously there were only synthetic drugs, that is oral tablets were available, but now there are biologic injections that have come to the market at affordable prices. So it is not that we cannot get over the situation. We can definitely, and we have to live successfully even if we have acquired any rheumatic disease. So with this I wish to conclude my speech. Thank you.